Moves. We will have a few opening remarks from our Institute Director, Dr. Paul Fedak, a cardiac surgeon here in Calgary. Then we have two fantastic speakers who are going to bring humor and motivation to our lives this evening. So Dr. Ross and Dr. Tavis Campbell. And then we will have a wide open section for you to ask any questions that you have of us. And then we'll close it off and we will be done by 8 o'clock. So that's where we're headed this evening. And with that, I'd just like to turn things over to Dr. Fedak to give us a few welcoming remarks.
Great, thanks so much, Lisa, and welcome everybody. It's great to see so many people interested in moving. I'll tell you a little bit about our institute. So we are a cardiovascular institute, and our goal is really to try to coordinate all of the clinical care for cardiovascular diseases with research and education in our community. And another really big part of what our institute tries to focus on is prevention. And we really try to do community outreach, things like the lectures tonight, to try to educate our public and try to keep everybody healthy. And the best way to treat cardiovascular disease is to prevent it. And what we know from a lot of research is that just moving, doing exercise, if you can do 150 minutes a week of reasonable cardiovascular aerobic exercise, it's incredible the impact that can have on your overall cardiovascular health and reducing the incidence of stroke and heart disease and many other issues that we treat in our hospitals every day. So we think this is a really great initiative. We want to get people moving. We want them to better understand the need for exercise, and we want to try to reduce some of the barriers that you may have for exercise. So tonight is one step in that direction. We've got two outstanding speakers, Dr. Campbell and Dr. Ross, and they're going to tell you a little bit more about how and why you should do these things. So thanks everybody for joining tonight. We're going to see if we can get you to work off all those extra pounds from COVID and social isolation and get everybody moving again. So have a great evening and all the best.
Thanks very much, Dr. Fedak. So a few housekeeping items. There's absolutely no pressure tonight to have your camera on. So if you do feel comfortable keeping it off, that's absolutely fine. We will record the presentation portion of tonight only so that it can live on our LibinMoves website so that we have that for people who were unable to attend this evening. If you do have any questions during the presentation, please go ahead and pop those in that chat box. I will make sure that our presenters get them answered either very briefly between presentations, but most definitely at the end. And then we just ask people to be mindful of your own privacy. So when you're asking questions, just what you choose to disclose as part of that. In Calgary, we are on the traditional lands of the Treaty 7 people, and we do like to pause and recognize that these are the traditional lands of the Pekainai, the Stoney Nakoda, the Siksika. And so we will proceed tonight in the spirit of sharing and collaboration that comes with those Indigenous peoples. So with that, it's my absolute pleasure to introduce you to Dr. Robert Ross, a professor within the School of Kinesiology and Health Studies at Queen's University. This is a very late night for him. His research program focuses on the development of strategies designed to manage lifestyle-based disease. He's also the past president of the Canadian Society for Exercise Physiology and the vice president of the College of Kinesiology in Ontario. Bob is a fellow of the American College of Sports Medicine, the American Heart Association, and the Canadian Academy of Health Sciences and the Canadian Society for Exercise Physiology. So with that, Bob, I will turn it over to you. And just a reminder, your line is still on mute.
Well, thank you very much, Lisa. Let me, hopefully this comes up and hopefully now we're in business. Let me check this. Does this work?
We can see it perfectly and it's advancing correctly.
All right, well, hello. Hello to everybody in Alberta land. I hear it's a little cold and snowy there as it is here in Kingston, Ontario. What a wonderful opportunity it is for me to share with you some of the highlights of the newly released Canadian 24-hour movement guidelines for adults. Trust me when I say when you work 3 or 4 years on something, it certainly is nice to have the opportunity to get out and tell people about what it is that you were working on. So that's my charge here. So away we go then. I want to, I'll begin by saying, identifying to you that actually what we've done in Canada is created two 24-hour movement guidelines, one for adults aged 18 to 64, and one for adults aged 65 years and older. And perhaps it comes as no surprise to you that there's not many glaring differences between the two. And some of you who might be approaching my age would say that makes sense. What magic happens when you go from 64 to 65? Well, of course, not much. But there are a few important differences, and I will point them out to you over my my time with you. I will tell you, I'll end with this slide as well, but if you want to have access to the guidelines, they're the propriety of the Canadian Society of Exercise Physiology. And very simply, if you go to this website I'm indicating here, ccepguidelines.ca, and you'll see very clearly how to toggle through and download the guidelines and the public health messages, which I'll allude to in a few minutes. It's very easy to do. Of course, it's free of charge, as many copies as you like, and the instructions are there. Everything that you need that I'm going to speak to over the next 15 minutes, you can find right there. In case you were wondering, so in October of last year, we launched the guidelines, 24-hour movement guidelines for adults. We have in Canada 24-hour movement guidelines for really the entire family. So if you're a mother, father, and wondering, well, are these guidelines specific for me? Well, yes, tonight I'm going to address only adults, but at the same website, you can download the 24-hour guidelines with their recommendations for children and youth and the early years, as I indicate here. So really, what we did in October was complete the family of 24-hour guidelines across the entire age span. And we're very proud of that because Canada is the first country to do so. So let me begin with some of the highlights and tell you some of the observations that are unique within 24-hour movement guidelines. The first, that in the guidelines for both adult age group, we recognize for the very first time that light physical activity or activities of daily living convey a substantial health benefit. This is the first, and the reason it's the first is because we've been a group who have evaluated the evidence most recently, and we now have enough evidence to give us confidence to say this is true. And I'm going to speak more about that in a minute, but this is just an outstanding opportunity, I think, for all Canadians. And again, I'll get to that in a few minutes. Another first for adults is that we have sedentary behavior guidelines. How much you should sit and what you should be watching when you sit are guidelines that I will speak to. And again, this is a first for Canadian adults. Another important new observation in these guidelines is that the moderate to vigorous physical activity, and I'll speak to that in a few minutes as well, that's more your structured physical activity. Guidelines in the past said that had to be accumulated in 10-minute bouts, no more. One, if you accumulate moderate to vigorous physical activity in 1, 2, or 3-minute bouts, whatever is suitable for you, that's perfect. That conveys health benefits. And again, I'll speak to that in a few minutes. And then we also have, for the very first time in Canada, recommendations for sleep duration and quality. So these are 4 unique aspects of the 24-hour movement guidelines for adults that we have not had in the past. And I'm delighted to share them with you today. But here's the most important one. And I'm going to spend a few of my valuable minutes at the beginning to expand on this, because I really want to make sure you understand what this means. So the observation is the composition of the movement behaviors, sleep, sedentary, and physical activity across the entire 24-hour day is associated with health. And I want to, as I said, take a minute to explain this to you because it's really what makes the 24-hour movement guidelines unique. So in the past, what we have had are guidelines really in Canada. The only guideline we really had was a physical activity guideline. And what I'm going to take a second here are 4 icons here. This is the moderate to vigorous physical activity icon. This is the light physical activity. This is sedentary time. And this is sleep. I know it looks like a happy face, but it's not. It's supposed to be a moon with 2 stars there. It just looks like a happy face, but that's the sleep. So in the past, the really important point is we've considered these behaviors in isolation. In other words, if you did your 30 minutes of moderate to vigorous physical activity, because that's what the past guidelines recommended, and then you sat in the recliner for the rest of the day, you had met the guideline. But that is not the optimal way to spend your day. 24-hour guidelines do not take behaviors in isolation. What they do is consider these behaviors as they coexist. In other words, we consider everything that you're doing in the day to matter with respect to health. So the composition of movement behaviors matter. We're not going to isolate. We're going to look at all of them in integrated way and together. And I'd like to show you a few examples of that. So in a 24-hour day, for example, by necessity, if you change one of the behaviors, you necessarily have to change the others. That makes sense to you. If I take away from my sedentary time, I have to do something with it. I'm either going to do light physical activity, moderate, or sleep. So what this simple observation initiated with researchers worldwide was to suggest that, well, if that's true, maybe it's the composition of those behaviors that really convey the optimal health benefit. So in other words, if you shift or change the proportion of any one of these behaviors. So in my example here, I'm increasing moderate to vigorous physical activity and I'm decreasing sedentary time. Well, the good news is these operate in tandem. They integrate, they operate together, and together they improve health. So instead of isolating one of the activities, we look at all of the activities, have recommendations for all of them, and consider them not in isolation, but together. And what the public health message is that your whole day matters. And this is really fundamental. So we're not just slapping together 3 or 4 different guidelines, one for sleep, physical activity, and sedentary. They operationalize together. They work together to improve health. So let me give you an example to make sure this point is made clear, or at least as clear as I can make it at 9 o'clock in the evening. So what the observation is that when you reallocate some sedentary time into any other of the movement behaviors, that's associated with health benefit, right? So in my cartoons shown here, if, for example, we taking out from the screen time here, the sedentary time, and we shift time into, in this particular case, light physical activity and moderate physical activity, then we have a health benefit. Another example that I show to you here, if you reallocate more time into, so you don't take away time from moderate to vigorous, but you add time to moderate to vigorous physical activity from any other movement behaviors, that's also associated with health benefit. And that's what I'm showing to you here. We take time out of light physical activity and we put it into moderate physical activity, and that's associated with health benefit. One more message here before I move on. We never sacrifice sleep time. So for example, if you're thinking, boy, oh boy, I understand this, I'm going to beat the system. I'm going to take 7 hours out of my sleep time and I'm going to add it to my light physical activity and I'm going to live till I'm 105. It doesn't work that way. Sleep is a very valuable behavior on the continuum of movement behaviors. Yes, I appreciate you're not moving, but in Canada, we consider that an integral part of a healthy day, and we always want to preserve. Okay, so now let me, with my remaining time, look at the individual recommendations that make up part of both of the guidelines, and I'll try to draw out a few implications that may be important for you to consider. So the recommendation that some of you may be very familiar with that has not changed in many decades now is that the recommendation for both age groups now doesn't change, is that for moderate vigorous activity, you try to accumulate about 150 minutes of moderate to vigorous physical activity, or MVA, per week. Now, that's not per day, that's per week. And again, I say there's no longer a requirement to acquire that time in 10-minute bouts. So if you do 30 minutes of MVPA one day and 5 minutes the next day and 25 the next day, or 1 the day after that, it doesn't matter. Anything that you do that's moderate to vigorous intensity matters. Now, there's 2 other recommendations that I want to highlight under the moderate to vigorous that are also very, very important. As in past physical activity guidelines, the recommendation is that strengthening activities using the major muscle groups, and I think that makes sense to most of you. You do that twice a week. And here's one of the recommendations that's different for older adults. For older adults, we strongly recommend that physical activities that challenge balance be included in the physical activity regimen. So it's Tai Chi, it's yoga, it's practice standing on one leg. Of course, preventing falls is a major challenge for us with older adults, and physical activities that challenge balance have been shown to contribute to fall prevention, and that's very, very important. In case some of you weren't sure, how do I distinguish moderate intensity or vigorous intensity exercise? I think that the talk test is one that I use. We have been using in our own research world for many years. So a person doing moderate intensity exercise could talk, but probably not sing a tune during your activity. If you're doing vigorous exercise, that probably gets closer to jogging or very purposeful brisk walking. And you may not be able to carry on a long conversation doing vigorous activity. So moderate and vigorous sometimes define that way. So again, what does it mean for you? Well, I think the new observation really is that participation in MVPA of any length provides options for you. I think if you were the type of person that just couldn't fit a 30-minute bout of moderate to vigorous physical activity in your day, it matters not now. However, you can accumulate those type of minutes, as I just described, will convey health benefit. And I think one of the themes that I'm getting across this evening, hopefully, will be that I think 24-hour movement guidelines give Canadian adults options that they can now use that would fit their own lifestyle. The recommendation for light physical activity is the same for both age group. Several hours of light physical activities, including standing. And as I said, this is the first recognition of the health benefits associated with light physical activity. So in other words, if you are either unwilling or unable to perform moderate to vigorous physical activity, it's okay. Activities of daily living, chores around the house, chores outside of the house, doing the vacuuming, walking in the mall. All those kinds of activities are associated with a health benefit. And I think that's such a positive message for Canadian adults. And this is a first. So we're very happy with that. And we hope that will be recognized by Canadians from coast to coast. So again, light intensity physical activity, activities of daily living, casual walking, household chores, gardening, those kinds of activities as depicted here, these activities convey health benefits. The recommendation for sedentary time, again, this is new. Perhaps some of you are aware that it's not only how much you move that counts with respect to improving health, but how little you sit also counts in terms of improving health. And the recommendation for both adult age groups is that we limit sedentary time to 8 hours or less, no more than 3 hours of recreational screen time, and to break up long periods as often as possible. So if you can get up, if you're at work, many of you are not at work now, but even if you're at home, try as often as you can to break up those long sitting periods, and try as best you can to limit the number of hours of recreational screen time that would fit into your day. The last recommendation is that for sleep, and this is the other recommendation that changes depending on your age, but the difference is subtle. The evidence now evaluated by our team of experts suggests 7 to 9 hours of good quality sleep on a regular basis with consistent bed and wake up times as much as possible for 18 to 64-year-olds, 1 less hour, 7 to 8 hours of the same good quality sleep, consistent bed and wake up for older adults. So that's the other, along with activities that challenge balance and the sleep, quality sleep difference, the number of hours. Those are really the two differences between our guidelines for 18 to 64 and 65 years and older. Well, as I come close to the end of my time here, I want to point out a few messages that are on both the guidelines that in some ways echo what I've just said, but in other ways point out some very key points. So the first point is that for health benefits, adults should be physically active each day, but also minimize sedentary behavior and achieve sufficient sleep. So the whole day matters is what this message and recommendation is saying. And again, unique to 24-hour guidelines, replacing sedentary behavior with additional physical activity and trading light physical activity for more moderate to vigorous physical activity while preserving sufficient sleep matters. What I mean by matter, can provide greater health benefits. And like I showed you at the beginning, I think this is a fundamental, it's the principal assertion, the unique aspect of 24-hour guidelines, and hopefully that point is coming across to you. One more observation that's particularly important, right down at the bottom of the guidelines, and maybe some of you can't see these very clearly, but here's what it says, very important. Progressing towards any of the targets that I've just identified will result in some health benefits. So say you're a person, say, Dr. Ross, there's no way in my lifetime I can accumulate 150 minutes per week of moderate to vigorous physical activity, but I think I can accumulate 75. Good for you, says Dr. Ross. Give yourself a hug. Well done. Why? Because there's no lower threshold for health benefit. However you progress towards those targets will provide health benefit. As a matter of fact, for most of the diseases that we're aware of, the biggest bang for your buck is achieved when you go from sedentary lifestyle to doing just something, much less than the guideline targets. So this, I think, is good news. In other words, what I'm saying, some physical activity is always better than none, always better than none. So on any given day, you can't reach a guideline, you can't do what you thought you could do, but you could do some good for you. That's fantastic. Well done. So what does it mean for you? I think integration of movement behaviors provides really some unique opportunities for you. It allows you to engage in movement behaviors in a way that reflects and respects your individuality, as I like to say, or your preferences. You can make the guidelines work for you, knowing that all of them, all of the guidelines, sleep, physical activity, sedentary, convey benefit, what works for you on any given day. That should empower you. I won't say much about that because I'm sure Dr. Campbell, who follows me, who knows much more about a behavior modification and how to change your lifestyle in a way that works for you, he'll speak to that. But I would echo and say that that's very, very important. And of course, doing these things will improve your health and will improve your quality of life, your daily quality of life, which many think is even more important than how much you reduce your risk factors. So here's an example of our public-facing material that you can get at the same CSET guideline, the website. You can download this material. This is for the public. It's simply simplifying what I just said. You move more, reduce your sedentary time, and sleep well. All of these integrate to improve your health, and thus your whole day matters. It provides you opportunity to engage in movement behaviors, as I say, that respect what you can do. The variability, your willingness, your abilities, and or your personal preferences, whatever they may be, you can find something here that works for you. So it provides, as I say, movement options for Canadians, and I think that's a tremendously encouraging message. At least I hope you accept that as an encouraging message. Just before I end my time with you, I want to be sure to acknowledge the wonderful people and experts that I had the great honor to work with over the past 3 years to put together these guidelines. I just wish I had time to tell you about the unique contributions that all of these individuals made. Not just these, but we had an international panel of experts who came to Canada to work with us. We had, for example, Juana from the World Health Organization. We had geriatricians and family physicians. We had international consultants from the United States, Sebastian from Scotland, Genevieve from Australia, who came to share their expertise and make sure that the recommendations that I just shared with you were based on the best available evidence. I'm just so honored and proud to be able to have worked with all of these people. So again, if you want to access the guidelines, this is where you go to access the guidelines. And when you do, always remember that these behaviors interact to promote and protect you from ill health. Find a way in the end to make these guidelines work for you. That's my fervent hope. And I hope that some of the points that I've shared here in my brief time with you make sense, and that you can use to have yourself move more, reduce sedentary time, and sleep well. I'll stop there. Thank you very much.
Thank you very much, Dr. Ross, for leaving us feeling empowered, and that no matter what type of activity that we're doing, it's the right type of activity. We did have one question come in the chat box. If you had to choose between catching up on sleep or adding exercise, what would you choose?
Well, as I said, as I mentioned, and I appreciate the question, we realize that depending on the work that you do, your ability, for example, say you're a shift worker, you're a truck driver, you're a nurse, a health practitioner, and Lord knows how our first line health professionals right now, how their day has been disturbed, to say the least. I think you leave it up to the individual to decide how they feel in terms of whether or not they want to catch up on sleep or add physical activity. But I will emphasize this. We do recognize in the guidelines that sleep is that one behavior that you always want to preserve. Sleep conveys in itself a tremendous health benefits. And if you can, do not sacrifice sleep to add physical activity. If shift work has your day upside down, then I understand that might be a challenge on some days. But the underwriting message is do what you can to preserve your sleep.
Excellent, Dr. Ross. Thank you very much. And thank you for a tremendous presentation. So now that we know what we are supposed to be doing, I'd like to introduce Dr. Tavis Campbell to talk about the pitfalls and the promises. How can we reach our fitness goals? So Dr. Campbell is a professor of clinical psychology and an adjunct in oncology at the University of Calgary, where he also holds the position of the Director of Clinical Training. He obtained his PhD from McGill University and completed his postdoc fellowship at Duke University Medical Center. His research interests involve identifying and understanding the biobehavioral mechanisms involved in the development, progression, and management of chronic illnesses such as cardiovascular disease, cancer, and insomnia. And if you haven't noticed, Dr. Campbell has been standing the entire time modeling the good behavior that Dr. Ross has just told us about. So Dr. Campbell, over to you.
Thanks so much. Can you hear me okay, Lisa?
I can hear you perfectly. And if you want to switch your slides from that view into presentation view, that would be even better.
Will do. There we are. Very good.
Love it.
I'm trying to practice what I preach tonight. Always a pleasure to listen to Dr. Ross. I always learn something new. And, one of the themes tonight is something is better than nothing, more is better than less, which is like, which I was happy to hear as I was standing here thinking like, I'm not doing a whole heck of a lot, but I'm doing something. And it's the best that I can do right now, given that I'm, tethered to the screen with you this evening. So thanks for inviting me tonight. I am a health psychologist, so I'm interested in how people are able to persist with complex medical regimens, with things that are asked of them to do. We all have this idea when we talk to psychologists and motivational psychologists like me, that motivation is sort of something like a commodity. Like people will tell me they want more of it. They'd like a little bit more motivation. What can I do about that? And maybe that's not quite the right way to think about it. But let me back up here a second and ask you, of course, to consider all of the things that you might like to see being done differently in your world. And whenever we visit a family doctor, for example, for our checkup, for our annual, for our physical, we'll often get this list of demands presented to us. We're supposed to very carefully attend to the prescribed medicines. We're supposed to increase our physical activity. We're supposed to, of course, eliminate smoking if we're smokers, eat more fruits and vegetables, maybe drop some weight, maybe reduce stress, maybe control our blood, and so on, and so on, and so on. And the point that I'm trying to make here is we have numerous demands that are placed on us, and we have only so much in the way of self-control resources. The idea that our willpower somehow is going to get us through difficult periods like a pandemic where we have numerous demands and not a lot of rewards is unlikely. In fact, it's very clear that at the end of a day when we're working and we have family demands and we've got to make dinner and we've got to do all these sorts of things, oftentimes our self-control resources, our willpower is completely depleted. So what can we do about that? Thankfully, 60 years of research in social psychology and the behavioral sciences has given us some idea of some strategies that we can use to circumvent that loss of self-control resources that occur as a consequence of our busy lives. So one thing, though, to begin with is to understand why it's so difficult to do all of this stuff. I've alluded, of course, to the demands during our day, but it's also important to point out that healthy behavior is oftentimes harder behavior. I would say it's often always harder behavior. So if the choice is between, gosh, eating an apple or eating apple pie, well, the apple pie tastes better, so why don't I do that? And we've evolved, of course, in a world that supports that kind of behavior. It's a good thing to do. If, exercise means getting up before work and pulling on your shoes and heading out into snowy Calgary on a weekday morning, or curling up and, getting some extra hours of sleep, but it's really difficult to kind of just figure that out, how that's going to work, how we're going to get to bed earlier and make these things happen in the morning. So we often pick, unsurprisingly, the path of least resistance. I mean, we have evolved to be a successful species because of this factor that we avoid pain and we approach things that are pleasurable. We have preference for short-term gain. It's typically favored over long-term consequences. They're a long way off. And you see this especially with young people. If you talk to them about exercise as a means of improving their heart health when they're 3, 4, 5 decades older, it doesn't really resonate. So our environment also pulls for unhealthy behaviors. Before the pandemic, I would travel regularly, I'd always be at the airport, and I would always be surprised at how few people would actually use a staircase. If the choice is between staircase and elevator or escalator, I would always kind of be amazed when someone picked the stairs. Kind of look at them like, what's wrong with them? It seems strange. They've got a little suitcase. Why are they dragging that up there? When the environment clearly pulls for unhealthy behaviors. Sometimes when I drive to work along McLeod Trail in Calgary, there's one corner where you have a Tim Hortons on the right-hand side of the road and the left-hand side of the road. You don't even need to cross traffic to get your sugar fix. You might have to leave the car. You can just do that. So we live in a world that isn't particularly helpful in terms of supporting our behaviors. And certainly there's a lot of work that can be done in improving the built environment and encouraging people to do things, but that takes time, a long time. So it's not particularly relevant for us. So what else can we do? Given that we live for comforts, and of course, like unhealthy behaviors have become sort of normative. Eating at all times is sort of normal. Offering people food is normal. Standing is abnormal, although it's becoming a little more normal. When I started to use a stand-up desk at work, people would be put off. They would say, do you want me to leave? Is everything okay? Where's your chair? And it's slowly becoming normative. And we see this as a consequence of some of the great work that people like Dr. Ross are doing. So typically, what provokes us to change, to exercise, for example? Well, oftentimes we receive these prescriptions, these directives from important people in our lives, people who care about us, our loved ones, our healthcare providers. They tell us what we should do. But the problem is, oftentimes we really don't like being told what to do. And there's often a reaction that comes from that. Who likes being told to take out the garbage? How many people have teenagers who don't appreciate being told what to do? Most of us really kind of don't appreciate that. And we react with a yeah, but, with a resistance. I was going to do that. Yes, I could, but it's a normal kind of response to that provocation. And so let me run through a healthcare encounter here, a fairly typical one that I've heard many times in observing physicians, family physicians, and specialist physicians interact with their patients. So here we have a doctor who says, listen, you should exercise. It's very important. If not, your blood pressure is going to be too high. You're at risk of all these health consequences. The person says, oh, I try to, but it's busy. They're resisting, right? They feel like, hard pressed here. Well, the doctor, very in a well-meaning fashion, says, hey, you can buy a treadmill. I have a treadmill. And you just have to find a place to do it. Patient says, yeah, I could, but I don't really like treadmills or home fitness equipment, and I'm in a rush. And then there's arguing. Don't you see how important this is for you? You should be doing this. This really matters. And this is what I'm talking about, because this is the kind of thing that is typical in terms of trying to get people to change. The physician might say, you got to do this or else. And this kind of exchange results in two things only. The provider and the patient feel super frustrated, and there's very little likelihood of change, yeah? Very little likelihood of change. So I think that this kind of approach, while well-meaning and really typical, is wildly ineffective. In fact, we know from research studies that it does very little. So we know that about 5% to 10% maximum, that's being very generous, of people will respond favorably to being lectured to having someone wag their finger at you and tell you why you need to do this stuff. Nobody likes to be told what to do. So what do we do instead? We know that from presentations like that of Dr. Ross, that increasing physical activity and exercise is good, preserving sleep, good, but it's easier said than done, yeah? The motivation to maintain that, and especially to maintain it over the long term, is difficult. As a psychologist, I'm also very interested in goal setting and things like New Year's resolutions. And we know, for example, by now, at the very beginning of February, most people, the vast majority who have made New Year's resolutions to increase their physical activity, for example, have failed. And it's unsurprising because their strategies tend to be kind of, well, wildly ineffective. And the first thing that doesn't work is to have people lecture you and sort of tell you what to do. Because ultimately, oftentimes, it's not so much that we don't know what to do. There's very few of you coming here to this talk tonight thinking exercise is not good for me, or maybe smoking is a good idea, or maybe I should really just focus on eating lots of sugar and fast food and processed foods and so on. We generally get a sense that this isn't good for us, but again, easier said than done, very difficult to do. So the problem with that kind of lecture-y, preachy kind of approach is it doesn't really do much for your motivation. In order to change, people really need to feel that change is possible, and that it's going to be personally meaningful and beneficial in some way, not because of what someone tells you, but because it resonates with what's important to you and your values. So change ultimately very unlikely if the person who's trying to motivate you, quote unquote, is just reeling off a bunch of stuff that doesn't really make a lot of sense to you, that isn't important in your situation. So I always like to start off about how not to do things. And again, you know, you can imagine as a clinical psychologist, if someone came to see me and said that they were suffering from a major depressive episode, and I said, you know what, sir, that's really not good for you. Depressed mood, it's associated with all kinds of negative outcomes. It's bad for your work. It's bad for your relationships. You really need to kind of like stop that, okay? So get up off the couch, get out there and feel better, right? That's what you need to do. It would be kind of laughable to do that, but oftentimes that's the kind of approach that's used in healthcare. Even worse, sometimes fear is used, yeah? People use that with you, and we use that on ourselves as well. Oh my gosh, if I don't do this, something terrible is going to happen. And that's a really bad idea, to try to use negative affect, negative emotional states to promote health behavior change. And so, you know, for example, many people over the holiday period that's just passed, maybe they've been sedentary, maybe they packed on a few pounds that they're unhappy with, and maybe they don't feel so great about themselves as a consequence. And people aren't stupid. They know that they can do something about this. So they'll go and they'll perhaps purchase some fitness equipment. We know from sellers like Amazon and the Home Shopping Network that most of the fitness equipment that's sold during the year is early in the year. And people will use the equipment because they feel bad about themselves. They feel guilt, they feel shame, and maybe they'll start to move and that guilt and shame will evaporate. Unfortunately, so does their motivation to continue. And so we know that by June or July, very few people are still using this equipment. The other approach that's used in healthcare is to be a cheerleader. I know you can do this. Just try your best and everything will be okay. This kind of indiscriminate positive reinforcement. Well, there's much more that we can do. We can talk about with our healthcare providers what our goal is, what matters to us, and also what kind of tasks we'd be willing to do to make it there. All right, so this is the alternative approach. We move away from this very simple conversation around, don't you want to take care of yourself? Of course we do. We all want this. And we move more towards why you might want to take care of yourself. How hard are you willing to work to take care of yourself? And how willing are you to make choices that actually increase burden, that are a little bit difficult in the short term to improve your health in the long run? And this is very difficult. We know that previous behavior is a good predictor of future behavior. And so we need to really address these kinds of concerns in order to kind of maximize the likelihood that people will be successful in terms of their change in the long term. One of the ways of doing this is to take a moment and to do a sophisticated cost-benefit analysis, because we shouldn't pretend that exercising comes with no costs. It does. It takes time and it takes effort. And, you know, by definition, of course, exercising takes time away from other things. As Dr. Ross very correctly kind of pointed out, I had to laugh when he was talking about screen time and television watching, because of course, if you increase your physical activity, if you up your exercise, maybe you'll take some time away from the screen. And, you know, it reminded me that screen time, that watching television is probably the worst activity in terms of stress management. So there's almost nothing that you can do that will reduce or lower your mood more than watching television. So what happens when people watch television is they have a sort of a baseline mood state that might temporarily improve while they watch TV. They feel a little bit better because they're distracted, maybe engaged by the content. But afterwards, when they turn it off, their mood is actually worse. It doesn't stick around. And in fact, you can do even just sitting in a chair staring at the ceiling, resting, and your mood will be much better than the pattern that we see with watching television. It's quite fascinating. It's the opposite of a flow state, if you've heard of that. So yeah, there are advantages to health behaviors, and that's important to kind of identify. And the advantages for you, not the ones that your healthcare provider tells you about, but the ones that you think are personally meaningful. But also, let's be clear here, there are disadvantages to ignoring the health behavior. There are disadvantages to the actual health behavior, and there are advantages to ignoring the health behavior. Like we can rest and we can ignore and we can deny, and maybe that's easier in the short term. So, you know, it's very important to kind of like have this conversation with yourself, or maybe make a little bit of a grid and take this to your family doctor, or talk to your exercise physiologist or your trainer about this sort of thing. So you better understand what some of the barriers are that you need to address in order to improve things. Okay. So again, disadvantages of status quo. What concerns you if you don't exercise? Advantages of change. What would you be able to do if you exercise that you may have trouble doing now? These are really good questions to ask of yourself. And maybe most importantly, how would exercising improve your life, including your quality of life? Because it's tempting for healthcare providers to tell you that you should exercise to reduce your blood pressure or to improve your heart health. And maybe that makes good sense to you. But if for you really what matters is being able to get out and go skiing with your grandkids and keep up with them, then that's a great reason. If for you, the desire to exercise, well, maybe it involves some vanity. Maybe you want to look good when you go to the lake this summer. You know, who am I to criticize you for that? Fantastic. If that's your motivation, I'm good with that. That's okay too. So it's really important, I think, to identify why you might want to do this and to remind yourself when it's dark and cold and snowing, what the reasons are that really are important for you, rather than wagging your finger at yourself and internalizing what you've been told all your life, that you should do this. If you don't do this, you're lazy, and it's really important and it matters. Instead, go with why it could improve your life, how it could improve your life, and so on. In terms of maintaining the motivation over time, it's really important, again, to remind yourself of why it matters so that it starts to incorporate into your self-identity. So when I think about some examples of this, I think of, people who've joined organizations like the Running Room, and they start to hang out with other people who are starting to run, and they identify as runners, and they're part of a club, and they feel connected to something larger than themselves. My wife, Cassandra, uses a Peloton bicycle, and she feels connected to that community because there's messaging and texting and high fives online. There's all kinds of reasons why, you know, you can exercise, and the challenge is to find ways in which you feel a sense of volition, like you voluntarily want to do this. You don't feel controlled. You feel some competence, like you can do this, and you know, you get it. You're not sort of tripping or struggling, and you feel connected to something larger than yourself. When I'm at organizations like the Total Cardiology Rehabilitation Center program, it's a wonderful cardiac rehabilitation program that we have in the city. Sometimes I see people walking around looking miserable. They don't want to be there. They don't like the smell of the chlorine. They don't like trudging around. Conversely, I see people there who are thrilled to be there. They like watching the varsity athletes. They think it's fantastic. And I think for those folks who don't want to be there, well, please don't come and be here, because it won't last in the long term. Find something from the myriad of opportunities that you'll actually enjoy and that makes sense to you, and you can connect to your values. In other words, the strengths or qualities that you want to express in your life and daily patterns of action. That's ultimately what matters. I'd like to end with a little bit of an anecdote, if you'll allow me. And it's a good example of how our behavior can be sort of, circumvented if we tie it to values. So if I were to kind of present this dilemma to you, which would you prefer? The fresh baked, beautiful cookies on one side of your screen, they smell good, they look good, the color's right, or these terrible, misshapen, burnt 2-day-old cookies on the other side of the screen? Which would you choose? I think the answer is obvious. You want the good cookies. But let's consider for a second that your 6-year-old granddaughter came up with the idea to bake cookies and worked super hard to make these for you and insisted that her dad bring these to you so that they arrived in time. Which one would you choose then? You might choose the one that's sort of a little bit misshapen, a little bit uneven, a little bit blackened, because it really is important. It matters to you. It's sort of a no-brainer. And it's a simple example, but I think a powerful one that highlights the notion that if we can tie our behaviors to our values, to things that matter to us, that reduces our stress and improves our likelihood of maintaining motivation over time. So with that, I will end. Thank you so much for your attention.
Thank you so much, Dr. Campbell, for being here. And we're going to open it up in just a moment for any questions or comments from the audience. Just take a moment and drop any you have into the chat box. And while you're doing that, I just want to give us a bit of a brief summary. So we started off tonight and Dr. Ross told us what we need to do, right? 150 minutes of activity a week and preserving your sleep. And we dropped the link to those guidelines into the chat box so you can check those out in full detail. He empowered us to find options that fit into your life. And remember that some is better than none and that it all adds up. And then Dr. Campbell has validated that the struggle is real. The time, money, effort, and motivation that it takes to be active can all be legitimate barriers. But change is possible. Pause, reflect after this session tonight. Find your why on why you want to be active, whether that's participating in an activity, whether that's hanging out with people you love and doing something fun, but find your why, and that will anchor you as you go through your journey. On that journey, be kind to yourself. You don't be active every day. That's okay. And we had Dr. Ross validate that as well. And finally, Dr. Campbell said, find your connection. And that's where LibinMoves comes in. So this is the start of a 5-month journey where we're going to try and foster connection to activity amongst Calgarians. We will be there for you with free activity videos. So if you wanted to try Tai Chi, but really didn't get around to doing it, it can come straight into your home versus live or record it. If you wanted to try dance, yoga, working out with a trainer, there are even workouts with the Flames. So we did have somebody tell us they were joining from the Flames game tonight. Mary, I haven't seen a score update. But if you want to leave the call tonight and work out with Valimaki and the strength and conditioning coach for the Calgary Flames, that's all possible through LibinMoves. So Megan is going to pull up a video just to show you briefly about the campaign and where to go for more information. And then I'll check and see if there are any questions in our chat box.
I like to move it, move it. I like to move it, move it. I like to move it, move it. You like to move it. I like to move it, move it. I like to move it, move it. I like to move it, move it. Woman, you're cute. I don't need no me. Bitch, not your body. You want me to pull up? Woman, you're cute. I don't need no me. Bitch, not your body. You want me to pull up? Physically fit, physically fit, physically. Woman, physically fit, physically fit, physically. Woman, you're nice, sweet, fantastic. Bitch, upon the ocean, not a big Titanic. Woman, you're nice, sweet, fine, energetic. Bitch, upon the ocean, not a big Titanic. Woman, you're nice, sweet, fantastic. Bitch, upon the ocean, not a big and it nice, sweet, find it all the thing. Bitch up on the ocean, that's a big Titanic. Come on. I like to move it, move it. I like to move it, move it. I like to move it, move it. You like to move it.
So hopefully that gives you a little wiggle this evening, and let me see if there are any questions. Excellent. So we have somebody committing to check out the workout with Falamaki. Any other questions or comments for us this evening?
Lisa, can I make one? If there's,
Sure, absolutely, Dr. Ross.
I wanted to just be sure to convey to all attending this evening that we don't have 24-hour exercise guidelines. We have 24-hour movement guidelines. And I know that the focus is on 150 minutes of moderate to vigorous, and even some of the examples, which are excellent examples in your video, show structured exercise. What's truly unique to the movement guidelines we shared today is those are good. If you're one of the 13% of Canadians that manage to accumulate that type of moderate to vigorous physical activity, well, good for you. But if you're part of the 87 other percent who just cannot manage to do that, what the movement guidelines clearly indicate, and it's evidence-based, is that the light physical activity that you do is associated with health benefit. If that's all you do, move more, doing those types of things, that's really important. So I just wanted to, not to say that structured exercise is not good. If you're doing structured exercise, that's great. But if that's not for you, if that's not for someone you know, and all they can do is move or put on a jacket in the time of COVID and go out with the family, appreciating social distancing and taking a walk or walking the dog, you are doing physical activity. And I just can't emphasize that enough, and want to make sure that's conveyed and that people leave knowing that that is true.
Excellent point. And yes, get up and move. Dog walking, dancing in your living room, vacuuming. We had a great comment saying cleaning the bathroom just got a lot more fun. So all of those things. Also in the chat box, we've dropped in a link to a survey about the event this evening to provide your feedback. So please go ahead and fill that out. Dr. Campbell, we have a question for you about how can we motivate an elderly parent to increase their movement, especially during a pandemic?
Oh my gosh, that's a tough question. Just about anything we can do to support the person in their efforts is helpful. Whether that's like if it's possible because they live in the same household, like exercising with them, a socially distanced walk, perhaps provision of some options rather again than to identify some simple singular molecular solution to their problems, to ask them, what are some of the things they've done in the past that they've found enjoyable that they might want to try again? Or what are some of the things that they've never tried that they might want to experiment with an attitude kind of non-judgmental curiosity, just to kind of, give it a shot and see if they enjoy it.
Excellent. We have another question. Reading in the literature that internal motivation, so for example, exercising because you enjoy it or find value, may result in longer term maintenance of physical activity than external motivation, for example, achieving a certain size or a weight. Are there any strategies you can recommend to help shift the type of motivation for people, or does that happen naturally over time?
Well, I'm happy to briefly take this one. I should give a plug. I teach a course in human motivation at the university, and I spend about 6 weeks on this exact question. But in all seriousness, it doesn't just happen. It's really important to address, I think, 3 key components of what's known as self-determination theory. And the first one is figuring out what you can do that provides you with a sense of volition, like you want to do it, or autonomy. You don't feel controlled. Number 2 is building slowly towards improving your self-efficacy, your belief that you can do something if you really want to, that sort of sense of competence. And third, again, and I can't underestimate that's this feeling of connection. So for my daughter Evangeline, that's her, in the past has been her swim club. For my mother-in-law Janine, that's identifying as being a gardener and being part of that kind of community. Whatever it is that you can do to feel part of something and not sort of isolated and alone, which is particularly important in a time like this.
Excellent. We also had a question about sleep resources. So will we have any of those? So Dr. Ross, can you expand on whether or not on the CSEP guidelines site, if there are any resources about how to achieve that high quality sleep that is so important?
How to achieve it is a little more of a behavioral a question or a personal issue that the person asking the question is going to have to figure out. I will say on the website there are videos that you can access, videos that the lead author for the sleep recommendation, the sedentary recommendation, and physical activities have all recorded 10-minute videos explaining the evidence and where they obtained it and how and why and what it means. So I think that might be helpful. And again, it's on the CSEP website, freely downloaded, no charge. And that might be helpful to the person who asked the question. Excellent,
Dr. Ross. Thank you very much. Dr. Campbell, do you want to add anything to that? I know one of your key initiatives is the ICANN sleep study.
Sure. I would say there are some really good evidence-based guidelines online. The American Academy of Sleep Medicine is one of them. And there's a difference, I guess, that should be pointed out between having some difficulty sleeping, where you might get some tips and tricks, good sleep hygiene and so on, that would be helpful. And people who actually have real insomnia, which is a real clinical disorder, and that requires some attention. So please do not be shy about bringing that up with your family doctor or healthcare provider.
Excellent. I'd also just like to add that one of the groups that the Libin Cardiovascular Institute has aligned with is the Kirby Center. So for more mature participants, the Kirby Center has tons of activities and it's a great place for connection. We do have some of their resources on our website, so just encourage people who have parents or who are older themselves that is an excellent resource for them. We've also had a question about the Go Get Fit app. So this is a free app that you can download through our website. It is designed by an emergency room physician from Alberta. So it's based on absolutely the best available evidence. And it really aligns with the talk that Dr. Campbell has given us this evening. So it relies on scheduling and building your own self-efficacy. And there are built-in reminders. So if you say you're going to do something on Tuesday at 8 a.m., you'll get a reminder on Monday night. Have you put your shoes by the door for the walk you said that you're going to do tomorrow? And then 10 minutes before you're supposed to go, you'll get another reminder to say that walk is coming up, good luck. And it really is sort of building on that self-efficacy and being a support for you as you go through your activity journey. Any final questions or comments? It's 10 seconds of awkward silence, so we'll go with that's it for this evening. I would like you just to take a minute again, please, in the chat box, do complete that survey. Your input is how we plan future events. So if there's something you want more of or less of, please do let us know. And thank you again for being here tonight. We look forward to welcoming you all into Libin Moves. Have a good evening, everybody. Thanks again.
Bye-bye.
Unmute.